Hi everyone, my name's Melissa Klein. I am a grad student at the Post University and I'm going to be discussing my performance assessment management project. Okay, so to just give you a little bit of background of my educational context, my educational environment is a higher education diagnostic ultrasound program. So the performance assessment I designed is for applications in adult abdominal sonography, which is an introductory class to abdominal ultrasound, which details abdominal ultrasound imaging and pathology correlating to imaging strategies, patient intake, and ultrasound techniques. The standard for this unit is the American Registry of Diagnostic Medical Sonographers, which is the national registration for ultrasound professionals. All right, so the performance task targets for this unit are first the knowledge targets, which describe the concepts and facts that students should know. And the knowledge targets are that students will know how to identify sonographic images of abdominal organs. They'll know the physiologic functions of abdominal organs and organ function correlation. They'll know the patient signs and symptoms correlating to ultrasound findings. And lastly, students will know common abdominal organ pathologies, and then they'll be able to relate them to patients clinically. The reasoning targets for this unit describe how students use their knowledge to then solve problems and reason. The reasoning targets for the applications in abdominal sonography final are that students will be able to evaluate patient intake and symptoms, they'll be able to analyze ultrasound pathology, and then make conclusions based on the intake of the patient and the ultrasound findings. The skill targets define how the student uses their reasoning and knowledge to then act skillfully. The skill targets for this final are that students will first proficiently and accurately produce sonographic images of the liver, pancreas, gallbladder, kidneys, and spleen. Second, they'll be able to recognize common pathologies within sonographic images of abdominal organs. And third, they'll be able to clinically correlate patient signs and symptoms to sonographic findings. And the last of the targets is the product targets, which describes how students use their skills, knowledge, and reasoning to create an actual product. So the product target for the unit of applications in adult sonography is that students will be able to actually create a complete abdominal ultrasound study from start to finish. So this involves a comprehensive patient intake, thorough sonographer assessment of the patient's signs and symptoms, and a diagnostic abdominal ultrasound with few errors that is catered to the patient's order or the physician's order and then the patient findings. The GRASPS acronym I found to be an excellent tool that educators can offer students prior to their assessment. This allows students to effectively prepare for their performance task by establishing the standard for success, and it allows students to be well aware of their expectations and what to expect from the performance task. So within this final, the goal of the student is to complete the necessary patient intake, interaction, and questioning, followed by obtaining all the diagnostic images necessary for a complete abdominal ultrasound in 30 minutes or less. The role of the student is a registered diagnostic medical sonographer. The audience is a reading radiologist and then the patient's referring provider. The scenario or procedure of the performance task is that the student will be scanning a patient within the diagnostic imaging department of a hospital, and the patient will present with a common complaint. The product of the assessment would be a completed intake form and a complete diagnostic abdominal ultrasound. So the complete diagnostic abdominal ultrasound includes a thorough patient intake, which involves discussing patient demographics, their symptoms, and then having a look and being very familiar with the physician's order. And second, the student will need to have a quality diagnostic abdominal ultrasound with very few errors. And then they'll need to, most importantly, make connections to the patient intake, their signs and symptoms, and the diagnostic physician's order. So basically, we're getting higher order thinking and big picture thinking to see their big picture thinking. The specific standard for success is the successful result would include the completed patient intake, thorough assessment of the patient's signs and symptoms, accompanied by a diagnostic imaging study that's catered to the physician's order and patient intake. And then additionally, there is a rubric that has more detailed, itemized grading for specific standards of success for excellence within this performance task. Okay, so to summarize the assessment critique of this performance task, the purpose of the assessment is to offer students meaning and value of the classroom topics beyond just a score or grade. This performance task is a summative assessment that aligns with real-world expectations of the diagnostic medical sonography professional. The learning targets are the foundation to the educational practices, instruction, and curriculum design. The achievement to be assessed is the student's ability to connect textbook knowledge with application to real-world scenarios. Students must be able to make these big picture connections for success as medical professionals. Educator objectivity is essential when assessing a performance task with a grading rubric. A key to ensuring objectivity in grading is to design a high-quality rubric that has clear specifications and defined expectations. A well-designed rubric should allow educators to grade each student objectively. And successful performance assessments allow students to be well aware of the grading standard, and students are welcome to be involved in creating the rubric or scoring criteria. As active participants in their assessments, students will learn the value of feedback and how to self-modify their performance in order to be lifelong learners, which is another goal of the unit. By completing this project, I have learned the essential role that performance tasks will play in assessing my students and how valuable they are. Performance assessments are an exceptional method for assessing students' understanding. They allow educators to incorporate large spectrum of conceptual targets based on a standard to ensure understanding and also to aid in students' learning. Performance assessments are an excellent way for educators to challenge students to make real-world connections with classroom content and assess higher order thinking. This is my little foster son. His name is Isaac. This is him eating his birthday cake on his first birthday. Check out that smile. Thank you for listening. And here are my references.